Do you know the name of most important cells in the distal tubules and collecting tubules? You don't know. So the most important cells in the distal tubule and the collecting tubules are the principal cells. They are very important. And why principal cells are important? They are important because they determine whether potassium has to be reabsorbed or secreted into the tubule. We discussed in our previous lecture that there is filtration, then there is reabsorption, and then there is again either reabsorption or secretion of potassium in the distal tubules and collecting tubules. The reabsorption in the proximal tubule and thick ascending limb of the loop of Henle is fixed, but this thing in the principal cells is variable. And how it is detected? Now they are the principal cells. They have their own principles, and they are the principals of this whole community. So they are doing their job very efficiently. Now see, the principal cells are the most important site for potassium excretion. Potassium can be reabsorbed or secreted on need. So if there is need of potassium, the secretion of potassium from the principal cells in the distal tubules and collecting tubules will be stopped, and there will be reabsorption. But if there is no need of potassium, or there is a regular intake of potassium, then these cells, the principal cells in the distal tubule, collecting tubule, they keep on secreting potassium into the tubule so that potassium go out of the kidney. Now, with normal 100 milliequivalent per day of potassium intake, around 92 milliequivalent per day is excreted. See, normally we consume around 100 milliequivalent per day of potassium, and out of that, around 92 milliequivalent is excreted through the kidneys. And out of this 92 milliequivalent, around 60%, around 60% of this is secreted in the distal and collecting tubule. This 60% is not secreted in the proximal tubule or the loop of Henle or the thin or thick limbs, but this is happening in the distal tubule and the collecting tubule, and especially by the principal cells. So with increase intake of potassium, there is increased excretion of potassium in the distal tubule and collecting tubule. With decrease intake of potassium, there is decreased secretion of potassium, and there is increased reabsorption by the intercalated cells in the distal segments. So the intercalated cells are there to obey the orders of the principals. Now, how the principal cells are operating? In the principal cells, here we have the principals in this region, and this is one principal cells. In the principal cells, the reabsorption starts on this side, on the luminal side. See, this side is the this is the basal side. This is the basal side. From the basal side, what happens is that this, through the help of this sodium potassium ATPase, sodium is reabsorbed from the cells, it is thrown out, and the potassium goes in. The concentration of potassium increases here, and the potassium of sodium decreases. So to fulfill the deficiency of sodium comes through the epithelial sodium channels. They come inside, and then they are again thrown outside from the tubular segment into the basal segment. Potassium, on the other hand, is thrown inside, and the concentration of potassium in the cells increases. When the concentration of potassium cells increases, they flow around down the gradient through big potassium channels and the renal outer medullary potassium channel, outer medullary channel. So that's how the principal cells operate, and that's how the principal cells are the principals, and they have their own principles, and that's how they maintain the potassium reabsorption or excretion depending upon the availability of potassium in the body.